So this video is for beginning to learn the somatosensory pathways. Specifically, this is going to be pain and temperature from the body. Okay, so we're starting in the periphery with a free nerve ending, right? Pain and temperature is carried by free nerve ending. So that's the receptor or end organ, and that's associated with a primary afferent axon, right? A primary afferent axon that has its cell body located in the dorsal root ganglion, right? So this is the dorsal root ganglion. This is the peripheral part of this pseudo-unipolar neuron. It then has a central portion of its axon. Remember that the action potential starts out here, travels along the axon past its cell body. The central portion of its axon will then enter the central nervous system at the level of the spinal cord. Okay, so here's the spinal cord. So it's going to enter the spinal cord and then it's going to synapse there. Okay, and I will attempt to draw a spinal cord here. Okay, so it's going to enter, okay, and it actually travels up within the spinal cord, okay? So if we were entering at T4, it's going to travel up a few levels, and it travels in this tract called Lissauer's tract. Lissauer's tract is a little white matter cap right on top of the dorsal horn, right? Here's the dorsal horn and the spinal cord. This is Lissauer's. Lissauer's tract. Okay, so there's no synapse yet. This is the central portion of these axon. So it's going to travel up. After it travels up, it will enter into the dorsal horn and synapse there. Okay, so it's going to synapse there. Okay, so the second order, this is the first order neuron. The second order neuron in the pathway then is in the dorsal horn of the spinal cord. Here's the second order neuron in the pathway. Okay, dorsal horn of the spinal cord. What does the second order neuron do? Hopefully you remember that for all second order neurons giving somatosensory information to consciousness, the axon of the second order neuron crosses the midline. Here's our midline. So the axon's going to cross. Okay, so the axon crosses the midline. And it crosses in this small space because remember that the spinal cord actually has a sulcus here. All right, so there's a little sulcus. And so there's not really much place for this axon to get. It's got to go underneath the gray matter and before this little sulcus. So this is called the ventral white commissure. Okay, ventral white commissure. Okay, so that's where the crossing of this pain and temperature pathway occurs. It travels over to the lateral portion of the spinal cord and then ascends. Okay, and it's going to ascend all the way up to the thalamus. This is information from the body. So the specific thalamic nucleus is the VPL. Ventral posterior lateral nucleus of the thalamus. Okay? And that then is the third order neuron in the pathway. What do the thalamic neurons do? Remember, they all ascend, they go over to primary somatosensory cortex. So that's the fourth order neuron in the pathway. This is primary somatosensory cortex, S1. Also known as Brodmann's areas 3, 1, and 2, located in the postcentral gyrus. Okay, so now the information has reached consciousness. So one thing to remember with pain and temperatures, pain is one of the first modalities that an organism needed. Okay, so if you think of that with the most primitive part of the central nervous system, the spinal cord, then you'll remember that the synapse between the first order and second order neuron occurs in the spinal cord, and the crossing of the midline occurs in the spinal cord. Oh, I forgot a very important thing. What are these axons called? We typically name the second order axons after they cross the midline. Well, we can see what they're called because we often name tracks by where they came from and where they're going to, and this track is no different. It's also its location. This is the lateral spino, coming from the spinal cord, thalamic, I'm not going to have room for that, thalamic tract. Okay, so that's these axons, second order axons of the pain and temperature fiber. So when you hear lateral spinal thalamic tract, hopefully you immediately think pain and temperature information, and the fact that this information has already crossed the midline. Okay, so the name of the tract comes from after the pathway has crossed. Okay, so let's look at some lesions here. So what happens if you have a lesion, not of the white matter, but just of the dorsal gray matter of the spinal cord, the dorsal horn? Okay, so I've lesioned just this gray matter of the dorsal horn. First question is, what modality will be lost? What sense will be lost? Well, spinal cord, hopefully that makes you think of pain and temperature. Okay, so when we have a lesion here, we're going to have a loss of pain and temperature. And where will that be? Where will that loss be? Okay, so let's go back. Let's find the receptors that don't work anymore. Here they are, right? So if this is the left side, this is still the left side, right? Here's the right side. Okay, so the lesion is in the left dorsal horn of the spinal cord. The receptors that I can no longer feel, the free nerve endings, are in the left side. If this is the T4 segment of the spinal cord, then you're actually going to have a loss from T4 a little bit, but also down to T6. And that is because of this little bit of spreading of the pain information out within Lissauer's tract. Okay, so some of the fibers will come in here and synapse right away. Many of them will ascend. Okay. So if the lesions at T4, the ones that entered down at T6 came up and ascended to the level of T4, so your pain and temperature loss will be from T4 to T6, and perhaps even more than that, but this will be the most severe loss. Okay, loss of pain and temperature on the left side with a left lesion. Okay, let's look what happens if you lesion the lateral spinal thalamic tract on the right side. Okay, we've got a lesion of the right lateral spinal thalamic tract. Okay, so hopefully you hear lateral spinal thalamic tract and think pain and temperature. So I've got a loss of pain and temperature, and where are the receptors where I can no longer feel? Here's the lesion, here's the receptors. The lesion's on the right, the receptors are on the left. Okay, so I've crossed the midline. Once the pathway crosses, if you have a lesion in the pathway after it's crossed the midline, the deficit will be contralateral to the lesion. Okay. So contralateral loss of pain and temperature. If I've lesioned the whole tract, the whole lateral spinal thalamic tract, then I'll have that loss of pain and temperature, the inability to feel pain and temperature on the whole left side of the body, okay, with the right side lesion. The whole left side of the body, not the head and face, but just the whole left side of the body. You can see if I have a lesion further up, I'll have similar things, except that when I get to the thalamus and the cortex, remember that the pain and temperature information will be there along with the fine discrimination touch. So if I have a lesion of the entire VPL, remember that I'll also have loss of fine discrimination touch and conscious proprioception. Okay. What if I have a lesion just of Lissauer's tract? Does that affect anything? Okay, so yeah, these axons are traveling in Lissauer's tract. That's the pain and temperature fibers. That's first order axons as they're ascending within the spinal cord. So yes, you'll have a loss of pain and temperature. The whole pathway hasn't crossed yet, right? You're still on the same side as where the pathway started. So therefore the symptoms will be ipsilateral to the lesion. Okay, so here's where I can't feel anymore with this lesion. So, and will it be focal or widespread if I have a lesion of Lissauer's tract? And the answer is focal. And why is it focal? Well, for the sacral segments, the pain and temperature already already entered at lower segments, and it's synapsed, and now it's traveling over here in the tract, right? So the sacral information is already over here in the lateral spinothalamic tract. So that's why you won't affect the sacral information, okay? So if you go up to cervical information, and that's true for lumbar too, right? Sacral and lumbar. And then if you go up to cervical information, that information hasn't entered. So a lesion at T4 and Lissauer's won't affect the pain and temperature fibers for the cervical dermatomes.